Welcome to the Nobody Tells You This podcast, where we will be debunking popular health myths, fads, so that you can get fact from fiction and make informed health choices. Join us every month for new episodes.
We're live.
Hi, everyone. Good afternoon. We are live for our next episode for our Nobody Tells You This podcast. My name is Veerpal, the Menopause Clinician. If you want to know about our full introduction, go to the episode 1 because we can't wait to deliver the episode for today. So we won't take too much of your time. I will hand over to Rav, the Neet Nutrition, and she will introduce herself quickly. And she got something very, very valuable to share today.
I hope you guys are listening. So if you are, and it's the 17th, and you're catching this episode on release, I want you to know we have launched an exclusive Menopause membership. So this is a space for women in their 30s plus to experience menopause as a way of empowering and uplifting and rising through a hugely important chapter in your health and in your life. You have got until the 31st of July to get yourself booked into that membership. There is a pay-as-you-go option. So if you're sitting on the fence and you think you don't know, there's nothing to lose. Also, annual membership. So if you know you want this support for the long run, you've been listening in, you want clinical advice, accountability with a twist of fun, then you need to get yourself in there before the 31st, because we will be having a celebration party on the 1st of August where we are having Menopause mocktail party and doing a goal-setting month for you over the month of August. So you get a whole month's free coaching before official start of 1st of September. So Menopause membership, pay monthly or pay annually. Get yourself in there. GP advocacy, you want someone to hold your hand, we have got your back. And now we will go into episode 5, top 5 health conditions. V, why do people need to know about these top 5 health conditions?
Because they are the top 5 health conditions, majority of individuals suffer from it, and they affect all the organs of the body, and they all linked to it. That's why it's very, very important to take the health on a higher level, and they are the basic mostly individuals suffer from, and we want to highlight. And not only that, we had a lot of questions from different individuals. I got this, why it's getting affected, this is not working. For example, if someone got kidney, it's hard to control the diabetic function. And we really want to highlight the brief, what actually they are, how they impact your body, and nobody tells you secret in between them as well. And obviously, what are the quick tips? We will touch on each condition in the later episodes, but we want to just touch base on each one quickly to give you an overview.
There's so much demand and there's only one episode a week, so we're trying to keep you updated. Really quickly, I started as a health coach January 2023 within a GP practice. It was not until January 2024 when I was helping my private clients grapple with their health that I even knew some of these are interconnected. So some of you may have loved ones with diagnoses that you don't even know linked to kidney disease and kidney function, or you may have yourself a predisposition or maybe a vulnerability to these. So stay locked in and listen to these top 5s, and then make sure you share this episode with everybody you love and care for.
Yes, it's very,
Number
very
1, over to Veerpal, diabetes.
Yes, diabetes is the very, very, and nowadays, a lot of individuals are getting diagnosed with the diabetes as soon as they cross 40, especially the type 2. And diabetes, what we call, is actually our pancreas stop when we say breaking down the glucose and the sugar levels, and it's the higher glucose sugar levels in our body, and it start to show the symptoms. And symptoms, some individuals don't feel the symptoms at all. Some individuals will feel the symptoms. It's extreme tiredness, headaches, feeling confused themselves as well, hot sweats, weight gain, and also going to the toilet again and again, thirsty. They need a lot of water as well at the same time. They wouldn't feel themselves. The body can tell something is physically wrong. And that's when it comes, they go to a doctor, and some individuals actually don't even go to the doctor. They just say, I don't know what it is. So it's very important when you reach 40s, have your blood test regularly, annually checked. And that will give you a profile. When they see your overall blood glucose levels are higher, and some comes on the borderline, some comes very higher. And that's when the intervention comes from the diet, lifestyle change, and the medication if it's required alongside as well. And I always say any health condition before we get into is 80% is your lifestyle change, 20% is the medication going to help. With medication help, you work with the diet and lifestyle and you start to bring your medication down. And some of you are already suffering from these health conditions. Do work on your diet and lifestyle. Good approach with the 80-20 rule, but really you don't need to be a saint, but be mindful when you are eating according to your taste buds and what your tongue is asking, your tummy is asking, and when actually you need the nutrition for your body. And that will really help you as well. That was the overall of quick diabetes, but I'm sure Rav have got quite a few questions on diabetes for me, so we can answer those.
I really want to emphasize what V said about the symptoms going unnoticed, but also a lot of people confuse those symptoms with aging symptoms, and they believe it's just a part of getting older, and that's why that's happening. And that's why it's a silent killer, because the onset can arrive without you knowing. You don't manage it, you think it's because you're getting older, and next thing you know, if it's not picked up by a chance blood test, you might be in the thick of it, and you might have already had the onset of the other conditions we're going to talk about. And I see this a lot now in younger children. Even we're getting really young children, aren't we, that are getting diagnosed?
Yes.
And there's a massive influence by the fast food, long shelf life products that are having on our accessibility to these choices of food, which is 80% lifestyle, and then affecting our long-term health. Diabetes, people are happy to just go take metformin, get a prescription. And we said this, didn't we? People were taking loads of prescriptions for their health conditions, less than mental health conditions. But it's exactly what V said. If you find yourself in the vulnerable situation, you're diagnosed, you have been given medication, please don't muck about with it like, I'll just take it when I think my blood sugars are high. Take it consistently, work with a professional to make the dietary changes, and you can start reversing diabetes.
Reversing any health condition, then you reverse it. And same goes for mental health. When we talk, people very feel like, I'm not antidepressant, I don't want the mental health. Sometimes your brain is not there to function or go to the baseline. So it's any health condition, you go to the baseline. To go to the baseline, you ask for a medical intervention. Then you can work on your mindset, your really changes in your lifestyle, whichever you need to control on. And then you start to reduce the medication, and then it stays the baseline. And as you said, Rav, fast food, everything is quicker. We want quick, everything quick and long shelf life, but then it's not healthy for us all the time. Yes, we have got very busy lifestyle. We want everything quicker. We're going to so change and adapt it to our taste buds. Just eat, Uber Eats is not helping. Supermarkets don't help as well at the same time. But then we say 80-20 rule. 80-20 again, go back, is very important to understand difference between diet and nutrition. Diet is to fulfill your calories, give energy to your body. Nutrition is actually nourishing all your organs, your heart, your liver, your kidney, your stomach as well, and your mind, brain as well. That is actually need nutrition as well. And nutrition is very, very important. From 7 days, if you are really on the over 30s, you need to have 5 days really good nutrition, healthy lifestyle as exercise, something for your brain, good food as well, which is good for your nutrition levels.
It brings down your cravings as well. So you'd be surprised.
Yeah. And the 2 days, you enjoy your life. You don't need to be saint. If you have got whatever is your favorite food, you do enjoy it. There is no, if someone say become a saint for 7 days, no, unless you are later on something really serious condition, then it's different. And same goes on a daily basis, as we discussed last time, Rav. If you're really going out for a dinner, you're going to have a nice meal or something, enjoy. You know, your lunch and breakfast need to be a little bit very mindful. If you know the dinner, you're just going to have something at home, you're busy in the evening, you're not going to enjoy your meal, have a nice, healthy or something good, like you can have your carbohydrate or something with it as well. So manage your food that way, and then give a little bit more steps and movement. And it's a very simple thing. It's not rocket science, but control is in our hands, how we want to do. And the doctors can't do anything. They only, if you go to a medical professional, only thing they can give is a medication, but every medical professional always will advise you lifestyle changes. And that is, as an individual, is in your hands. But priority is in your hand. If that's not your priority, nobody can take a priority for yourself. Nobody going to take a priority for yourself at the same time.
That's why the membership was so important to us, because
Yes.
it's, and there are other formats out there for people with health conditions, but enroll in an accountability, a buddy up scheme. Get your friends and family involved. Diabetes is not something to muck about with, because once you have the onset without management, it will lead to other long-term complications. And type 2 is distinctly different than type 1. So they will have a different management techniques and tools. One of the key things I want people to take away is, a lot of people, when they were diagnosed in the 80s, 90s, 2000s, my dad's generation, so people around the 60s, 70s, doctors would say lose weight, because the reduction of fat on the body is something that scientifically helps manage diabetes. Sometimes not with other conditions. Weight loss is not the answer for everything, but for diabetes, it really is. So they went off to try and lose weight, cutting calories, cutting fats, which have higher calories. But actually, with diabetes management, one of the things I always advise is nutrition. From a nutritional point of view, is your healthy omega-3 fats are so good for you.
Yeah.
Carbohydrate management, understanding difference between complex, simple carbohydrates, how you time your food, and then incorporating good fats, and when you can time your cakes, sweets, sugary substances, because you can't be a saint, like V said. And it's just about some understanding of higher fat meals, lower spikes on your blood sugar. And if you're going to have your sweets and cakes now and then, try to have them 30 to 60 minutes within eating, so they digest together.
Yes.
I was saying in the Punjabi one, if you have those on an empty stomach, you are going to spike your blood sugars. Blood sugars are meant to be spiked, that's normal, but not to the frequency where it will cause you an issue with your insulin. So and that's where the problems come in.
That's where all the problems comes. And then people struggle. And then when they say, I can't lose weight, I can't control my sugar. And as we talk about the other health condition related to the diabetes, two more important ones is, I think we will touch the kidney base first. Very, very important. The kidney levels, the kidney function really. So anyone who's diabetes, if you are diabetes or if you are not, you're curious what happens. One is your levels. Levels is just basic thing, but it really affects your other organs. It affects your heart, affects your liver, and majorly it affects your kidney levels. It really affects, and affects your eyes. And we have to check annually everything for your body, your feet as well, your circulation as well. You may have heard someone their circulation was so poor, they had to amputate their leg. They were diabetes, and it's very common, it's not uncommon. And they had to remove the kidney. They had kidney damage due to the diabetes. So that's why it's very important to highlight what the damage it can do to your body organs. It's not only about sugar levels, and you just meant. So that's why it's important to bring them down. And how it affects the kidney levels is the kidney functions really start to deteriorate. And that's why people who have kidney function problem, it's very hard for them to control the diabetes levels as well at the same time. The levels is hard to function, and for the kidney, unfortunately, there is and then people end up with dialysis, because only so much medication you can, because anything you do is going to affect your kidney, and the medication is going to affect kidneys. And lately we have noticed, even you have diabetes or no, we have in our especially South Asian community, a lot of people are with kidneys issues.
I didn't realize how. I really didn't know how common it was. And all the ladies approaching me in their 60s plus, I was like, what? So please, if you do have a diagnosis of pre-diabetes or diabetes, you can ask to have your kidney levels checked. If you've got family member diagnosed, pay attention, because most people just go have their checkup done and dusted. Don't think about it.
No, it's very important. And some people love majority. One is the health condition. Secondly, is very sort of never been highlighted. The people who are construction workers, very physical workers, to ease they feel from joint pain, body pain, they will take painkillers, paracetamol, cocodamol, naproxen, and it damages their kidney levels. Anyone who works in construction, very physical job, or they hair pain and they're like, this is hurting, and they end up having a regular habit of painkiller, and they are actually end up having a kidney damage. And we have so many people, if we say a good ratio is due to the other medical condition, even their doctors never knew about. It's just it became their habit at the end. They can't function without painkillers. And that's what
and they're demanding jobs. So and a lot of them are self-employed. So, if you don't go to work, you're not getting paid. We understand. And then you've got the mental pressure, right?
Yeah.
And that's why the 360 approach is so important with all health, like what you said about the puzzle, because they will be using it. It's a necessity. Go to work, so pop the painkillers.
Yeah, and that's why it has another issue. So if you are with kidney functions, it's not too many symptoms you will feel. Occasional pain, maybe urinary problems or other issues. It only comes from when we do the test. And that's why, again, highlighting importance of your annual blood test. If you don't suffer from any condition, even you have your annual blood test once you cross 40s, it's very important to check, or if you feel symptoms straight away. And the next, which we are going to highlight, which is very linked to it.
Quick tip though. So for example, I would say even with diabetes, stay hydrated. What about kidney disease? How can we look after our kidneys? What's one of the biggest things you could advise us?
Again, stay hydrated. Free from alcohol and mindful of what you eat. Free from alcohol with kidney as well, we say always. And also what medication you take in as well. If you have regular habit of painkillers, you need to stop them. Check with your healthcare professional any medication you take in as well, and stay hydrated and well-balanced diet as well at the same time, because kidney function is on your electrolytes levels, your sodium, potassium, magnesium, urea levels, phosphate levels, and that's how our kidney function get affected. So it's very, very important to have a balanced diet for kidney function as well, because anything we put, if someone go habit, like they take painkillers and then they take the drink, we call them energy drinks, it's going to damage the kidneys.
Oh man, that's so common. The prime drinks. I'm not going to name and shame anything, but I'm saying the kids really wanted them.
I can't even smell it.
Monster, Red Bull.
Yeah, Red Bull, Bullring, Red Bull. I don't even know the name of it.
I see people at the school gates. Yeah, I see parents with them. It's very true. And I've had a lot of taxi drivers that said to me, yeah, my diabetes and my kidney issue started because I was sedentary. I had to just keep going. I was a lorry driver, so I just used to eat the packet croissants.
Yeah, and then and then I wouldn't say it's man or woman. It's all individuals are actually it's the same, and it all depends what person says. So do Diet Coke. There is no Diet Coke, okay? It's not healthy. Either you have a full Coke or you don't have a Coke. There is no Diet Coke. It's a more damage to your health. All right.
So God, I say this all the time.
Yes. So don't fall for it, sugar-free. Like other day, we had a bottle on our dinner table, something, we had a meal, and my son said, can I have it? It says sugar-free, something he was fizzy drink. I said, no, you still got sugar. If you want to have it, just have it. But I am not giving you, it's healthy because it says sugar-free. You just have it. It's your proper naughty drink. But that's what it psychologically affects us. So be mindful of, because some people say, no, I'm just having a Diet Coke, I drink healthy or whatever. It's not healthy. Only thing healthy is plain water with a lemon or some other things into it.
Look after your kidneys, people.
And it's very, very important, these few changes to do as well. And for the heart, next one, we will go for the heart. Very, very important. And heart is, we know how important it is. Anything goes wrong with any organs, even brain, even kidneys, liver, stomach, anything is going to impact our heart. And heart gets impacted by different ways. It gets impacted if we go fat in our body, like raised cholesterol. Our blocked arteries due to the more fat. We go more overweight, obese or overweight, it's going to affect heart. Then we go as another one is, which really impact is diabetes, does impact our heart is as well. And blood pressure. When we have raised blood pressure, so the heart get impacted by two ways. Two ways it get impacted. One is by our mental function, and one is our physically what's going wrong. So if we go high fat in our body, or due to the diabetes or whatever, our overweight, the arteries get blocked, the blood is not pumping to all the walls, and then oxygen is not getting supplied, and our heart stop functioning, or it will raise the blood pressure. When that function is not going in a good full flow, that's when our heart will block, chest pains, ECG problem, blood pressure raise, and it's going to damage the heart, and eventually it needs some intervention, medication, or others. Another is when the brain effect is we have a clot, or we have blood clotting as well. The blood is too thin or thick, that impacts. Stress raise the blood pressure. Stress cause the heart attack as well. Suddenly your heart will collapse. You always in an anxiety, you always in a stress, you always having the palpitation, your heart is pumping all the time. That's due to this. When it's due to this, we have more risk of quicker heart damage.
Wow.
Okay, so when you say something happened and the person had a heart attack, because this is very important. That's why I always say mental health is equally important, because when something happen, it's quickly going to damage your heart, and that's when the heart attack come. Sometimes you say very healthy, fit person suddenly had a heart attack because something went in here. And the stroke, it leads to stroke and clot from the mental health stress or from the fat. If blood is too thin due to the due to the fat, it's going to cause a stroke. And we know how dangerous stroke is as well at the same time. So it's very, very important to think about these things. If you're really suffering from palpitations all the time, very busy, demanding, anxiety, agitated, do protect it. Ask for a help. And obviously, we give the intervention for this part to control the heart is breathing exercise, meditation, yoga.
Beta blockers. The beta. I was always like, how are these being given? And it makes sense, now.
Yeah, because it regulates the system. And then if some patient need medical intervention, you need beta blocker to really calm the palpitation and anxiety. Really, and that's when the medication comes. If someone is from 7 days, 5 days, the heart is doing this due to anxiety and stress, it's gonna pop out one day. And that's why the medication will help, because that person not in a state to do a yoga or a because they're not relaxing.
Exactly. No.
So it's not antidepressant you need beta blocker to really keep the levels and to regulate the heart healthy, so it doesn't go in a risk phase. And that's why it's important. And if you're having a raised blood pressure all the time, and that's not healthy, you're going to end up again heart attack. So do protect from that. And obviously then, as you're going to give a brilliant advice on weight, obesity, on the heart as well, and the cholesterol, your favorite topic as well, Rav.
No, it made me think of cholesterol and blood pressure, because cholesterol, having raised fat plaque in our blood circulating, they clump together, and then add the stress in and the pressure on the blood, then it can flick it off, and those are the things that then go and cause these blockages, and everything is so intimately linked. One of the things I find really interesting about cholesterol, if we're moving into cholesterol, is it's not necessarily impacted by weight loss. And I found that really fascinating. You really do have to focus on the dietary changes.
Yes.
And I think that's interesting about some of the work that you do outside of this holistically, about seed cycling and how beneficial that can be for people and their fat, their cholesterol, and just, what was I thinking about cholesterol? I don't know. That threw me. I know that, there's different types. So it's good to get intimately aware when you get your test, your LDL, your HDL. But even that is not even the full picture. So
it's not full picture. You gave a brilliant advice in our Punjabi episode, Rav, the pipe one, remember?
You imagine your beautiful veins and your arteries and everything in your body is malleable, and so you like the blood to be able to flow through it. And then if you're getting really stressed out and you're allowing stress to consume you, like what V said, then your blood will be going faster through your poor veins and arteries, and then they start to stiffen to deal with that pressure, and now you've got a higher pressure. So and you don't want kinks and stuff like that in your little veins, like the hose pipe veins. So I love thinking about it in a physiological level, like, I want to be for the blood to have happiness and accessibility and flow through my body.
And it's very important because it flows from every corner of our body, and it's very important. And if there is a more fat in our blood, it's going to obstruct it, and when it's going to obstruct it in our arteries and veins, it's not flowing and it's not giving enough oxygen, and that's why you will feel very tired, lack of focus and energy. Obviously you have physical symptoms of heart and the risk itself, but then
you're narrowing that poor vein or the arteries. like you're narrowing it smaller, and then you add diabetes into the mix, and somebody called it like sticky blood, and I was like, imagine the job that is trying to happen in there, and we're just here popping like, oh, just I don't know a thing,
Yeah,
and
give us everything. Yeah, we want everything, and
just
then
let's order
and
some
it's the
Just
body.
Eat. Or, no, I'm being very patronizing there, but no, I mean genuinely, it's easy to forget what's happening inside the body when we're not even thinking the
Yes.
automatic processes that are taking place.
Yeah, that's very, very important. And again, the same rule, you don't need to be a saint. 80-20, 5 days, good, 2 days, you enjoy your life. So you take the control in your hands and you know what your body. And once you're 40, you are not getting any, it's not a old age start, but your organs need more love and protection that time. And they are, and that's when you need to little bit nurture them in a different way. Give a good nutrition, but you still enjoy, keep your taste buds and your tummy and your eyes happy, because we eat for eyes and our mouth and our cravings as well. But be mindful how it can impact our health later as well at the same time. And they all link to each other. They all link to each other.
People can be skinny fat. It doesn't mean because of someone's size necessarily, because you can be small and have high triglycerides, high fat. And so when you get those cholesterol results, do look at them, take time to contact a health professional, like understand them. And I was thinking something that has now gone, because that's what perimenopause does. It'll be right there and then it's gone.
Then
Just
it's gone.
back down about cholesterol. So it's not necessarily impacted by weight. That's what it was. You don't have to stop foods that have higher cholesterol, like prawns and eggs, but you really want to focus initially on saturated fats. Try to reduce, like, don't stop eating the egg yolk, but then you're going to have a risk of higher saturated fat foods, right? So it's very important to start looking at the labels of your food packets. Turn the packet, look at when it says off fats, it will say saturated. When it says of carbohydrates, if you've got diabetes, of sugars. You'll start to get familiar with the numbers.
Yeah, that's very, very important as well. The same time to analyzing what actually is raising the fat or cholesterol levels, or when it's, for example, cheese. It's a pure invite to the cholesterol levels. You can eat all healthy and you're having a nice block of cheese every day. Some people have that habit. Bread and cheese and wine. Very nice, good combination, especially for summer. But then you won't be surprised when it become a habit, and then you have your cholesterol levels checked and they off the roof. No, I haven't had any burgers. All I was having just wine, bread, and cheese. But that's what's very important, to really know about how diet can really impact your organs as well at the same time.
And core facts, alcohol, smoking, not sleeping, these are all going to impact this.
Yeah, and then sleeping, if you're not sleeping, your cortisol levels going up, they're going up, then your all metabolism going up and down, and that's when it is going to cause havoc on your body in all the organs.
Did we mention it about the ghrelin and leptin when it comes to not having your sleep? But this will link very nicely into fatty liver and non-alcoholic fatty liver. So I'm going to park that there.
Yeah. And the next one is very important. My favorite is liver. I love liver. The reason I love liver is it's like a plant shoot. This organ is so clever. It's a plant shoot. Unless it's not gone to the extreme stage of cirrhosis or damage or hepatitis, you can really, just with your diet and nurturing, you can really bring it back to this, again, healthy liver.
And that's why love it back to health.
Yeah, so it's same as long as the root is not damaged. So that's why in a liver, it's a shoot. So when liver transplant happen, it's the tissue, the important tissue is get transplanted to the other individual. And that's why liver transplant is, because we got only one liver. You can't take one liver from the individual and give to another one. So that's what happens. So I always say, think about a plant. The plant whose roots are all on the base, but it's just gone. Weather was very hot. There was no water. He wasn't hydrated. The soil wasn't great. He just gone dead. And then you really give a nice soil. You change the soil. You give a nice shade and sunlight on a balanced level. Very not over watering it, but nice balanced water to it, it start to shoot again. And the weather is nice. If it's a spring, it's going to shoot again and you become a nice healthy plant. And the same way by eating all, and you got to remember everything passed by our liver, the water, alcohol, everything is the liver, is the border of everything which we put through our mouth, is the border. It crossed that border and it goes to blood, unless we directly intervene something to our blood. Everything which is going to by mouth is by our esophagus is has to pass the liver. Every drugs, every our burgers, pizzas, all the excipients and the tasty birds in them, all the drinks, everything, and poor liver get damaged and damaged and damaged. And that's when it happened. And a lot of people have fatty liver. They have even all the acidity, heartburn, bile acid, all the problems then liver has to give. You know, when we have heavy food, spicy food, too many chilies, then what happened in the morning is a heartburn and bile acid come because it's the liver couldn't cope and couldn't digest it. But then it's repeatedly happen. That's why people say, I have heartburn, I need Gaviscon, I need this, because liver needs something to control those acids in there with the gallbladder individually.
I've seen so many people since working in the NHS on anti-acids, on Lansoprazole, is it?
Lansoprazole, omeprazole, drinks, Gaviscon, peptide. Yes. And that's why it happens. And fatty liver is very common. If the patients having too much naughty diet, we say, and they have fatty liver, we say, alcohol increase the fatty liver. It does cause the fatty liver. That's the first damage it start with the liver. So if someone is on, we say some are functional alcoholics, some are non-functional alcoholics is that who have a drink, but they still do their old job every day. And I would say around 80% individuals who drink alcohol are functional alcoholics. So they wake up on time, they do all their fitness, they done everything, they come home in the evening, they like to have few beers, they like to have a bottle of wine. And it's equally men and women, all individuals are the same. And that become functional alcoholic. And we have when we do alcohol chart, a lot of individuals are alcoholic because, or they will go out in the evening, or maybe they never go out. I just have a few beers watching TV, rewind. It's called rewind sort of thing. And that can give a fatty liver, obviously, then liver damage individually. Non-functional alcoholics are actually, they can't function. That's what we call addiction. They all the time. And then liver cirrhosis is very common. Within few months, they will have a damaged liver. And that's very hard. They have to stop the alcohol. Otherwise, it's hard. Some people are genetically will have fatty liver. I have got fatty liver. That's from my genes. And then it never bothers me now, ever have symptoms. But with my, when I was pregnant with my first, that came into the light with the blood test and everything. And since then, I've been with a liver consultant. I have just annual checkups so to make its prevention for the future when I get old. So I had to do a few changes. I have to do when I check my levels and everything, what's going on. And with the liver, your body will tell you. The signs for liver is, I will say, your body color will change, will start to be more pale. You will feel itching on the body. That's another sign. When it's extreme levels of bile acids or ALT are increased or decreased, you will feel itching in your body, especially on your hand and feet. It's not necessary only in pregnancy. Also, you will feel, another thing is you can't digest your food. Your hunger you will not feel hungry that much, but you was before, and you will feel extremely tired as well. And obviously the heartburn, the acid reflux is symptoms as well from it as well. You will feel all of them. And the person go to a stage, they can't even have a drop of water when it goes to the extreme level. When it goes to the extreme levels, they can't. And then they have blood test done and the doctor check it, and then they always see. And then another thing I want to highlight is there is no treatment for liver. There is no treatment for liver unless it's damaged. Then the doctors give other thing. Only treatment we give is, again, go back to the plant, detox your body. Water, lemon, mint, not too much of carbohydrate. You need to really keep it not giving pressure to it, basically. You give less job to it, okay? Cut down on alcohol, fizzy drinks, everything. detox as a healthy, green, light food. That's why it's very important to have a very light food. And
Wow.
that's when it will start to come back to normal and you will feel normal. There is no tablets for liver damage, but when people have very severe levels, then we have got few medications which hospital give to just bring to the baseline few things. Obviously, if patients have liver cirrhosis, to manage the symptoms. So with if you're having acid reflux, something can be given to manage the acid reflux. If you're having too much itching, something can be
Yeah,
given.
so you're managing the symptoms, you're not getting to
Yeah.
the root, because the
And
root is through the food. You got to change the diet.
yeah, and the only thing to control the liver is through your diet and lifestyle. There is no tablets to control it itself as well. So that's why it's very important to work on your liver. And then what will happen if your liver is affected, we can't give you any other medication because
Wow.
so if you're diabetic, if you're cholesterol, if you go heart, and that's what for us pharmacists, it get really hard. What happened? We get thrown on a blood test report for a patient and a big list of medication. This patient's liver is on the borderline, everything. This is the list of medication. Can you check which they can have? And that's very important. Then we have to see what is very important for that patient, and that everything else had to be eliminated until the
Wow.
level normal. So if you suffer from health condition, do protect your liver because then it goes hand in hand as well. And sometimes you can't have medication because either your liver gonna be fully damaged or then we can't control your conditions other. So it's very important to really look into. That's why we wanted to highlight how connected all these organs
Yeah.
are with each other.
I
With
keep
the
thinking about those
medication.
poor kidneys as well. I'm thinking about the
Yeah.
kidneys and the medication, and then oh my God, it's just like whoosh.
Yes, yeah, and it's a catch-20. And then same
Mhm.
for a lot of medications, we have to check patients' kidney levels because some medication, for every medication we give in, there is a limit of kidney levels. And if the kidney levels go below, we can't give the medication to the patient on a regular
Yeah.
basis. So liver, and that's why it's very important, patients on medication, we check their kidney and their liver functions regularly. But if the
Yeah.
patients don't tell the doctor what painkillers they buy from the chemist or online, that is
Wow.
damaging their kidney and level. And then sometimes it's hard to understand why the kidney and liver levels are so abnormal. And then you dig down, ask the question. Oh, I have only 8 cocodamol a day, or I have 4 ibuprofen a day, or I have this many paracetamol a day. And then it comes to the light. Actually, they've been buying and then just taking it all the time.
Gosh, people, this is mind blowing because these behaviors can be so addictive. And I gave the example that my brother-in-law used to just take my mother-in-law's naproxen. Like
Yeah.
people
And
sharing medications, like please don't do that. Like that's the other thing we want to say. You've raised 2 really important things, and I want to say to people, check your family history. If there's any of these conditions in your family history, trying to be preventative, try to be proactive. Second
yes.
thing, if you've had gestational diabetes in pregnancy or any kind of liver issues in your pregnancy, then you kind of have to be more proactive again because you may be more susceptible. So this doesn't mean the end of the world. It just means using some of this information to your advantage.
Yeah.
And also, hands up, I did not know what a liver transplant was. I assumed like you get an organ, like a full liver. That's crazy. When you said that in the Punjabi episode, I was mind blown.
Yes, so because it's a shoot, the way liver, because we got only one liver, you can't take one person's liver and give to another one and leave him without a liver.
It makes
So,
so much sense when you said it to me. I was like, oh, okay.
yeah, so because we have got very successful rate with the live liver transplants as well,
Wow.
and then if the patient who dies, they donate their organs. That's a totally different process. But the aim of the thing is liver is like a shoot, okay? We don't want you to go look for even liver, but there's a lot of people who are on liver transplant. We got special liver specialist hospital only for this. And you talk about the pregnancy, 2 things you need to be very careful. Gestational diabetes is so common now. So I'm shocked to see that because when I'm managing the menopause women, obviously sometimes because I'm still a women's health pharmacist, and sometimes we have to review the medication for women are late pregnancy especially, and then they are on meds and we have to see. And gestational, every like 1 in 3 woman is coming with gestational diabetes. Obviously it's our diet and lifestyle as well. So do look after your early age as well, because you will end up having sort of gestational diabetes. It's not good. It's not nice. It's really can ruin your enjoying your pregnancy, because I
Yeah.
know in day and out how much women do suffer that time, and that's the last thing you want to be worried about. You want to enjoy your pregnancy. The sign, as you said, liver level in pregnancy. I personally, as a pharmacist, I knew I was 28 weeks pregnant. Suddenly I started itching,
Yeah.
very bad itching on my hand and feet. It's called obstetric colitis, and it would not bother you at all. It's no risk to you, but it's a risk to your unborn child. And when I started itching straight away, I knew what it was. I had no any other symptom. I called my hospital. I said, I got very bad itching. I think it's that. They said, why you think it's that? Because I said, I'm a pharmacist. I know this is the sign. I went blood test. My levels were off the chute. And then they put me on a weekly monitoring. If I wouldn't have been known, and women just think it was a very summer weather, and someone, I would have ignored it. Summer weather, I'm just itching, da. And if the level, I had to be induced, the baby had to come out because in 38 weeks, because it was not safe for the baby. And that's why stillborn birth is very common sometimes. No one knows what has happened, because the bile acid is indigested by the child, and that can happen. So it's a very common symptom sometimes. And that's why we want to highlight, it's a tiny little things of the symptoms. You do not ignore and don't assume. Don't even Google. Yeah, you Google to know, it's good. But be assertive. Like I was questioned by the hospital, how do you know? So do try to educate your families, because health conditions are getting worse day by day now, because everything is changing. And to protect our health and of our loved ones is don't ignore any symptoms. Do take action. Yeah.
And because my really good friend Sharon specializes in fatty liver and supporting people with non-alcoholic and fatty liver, because she lost her father to non-alcoholic fatty liver disease. And it's very common to have the Mediterranean diet as one of the ways of reversing it, supporting it. But even within your own cultural foods, there are ways that you'll be able to manage these conditions. You do not have to become a saint, stop your food, go to complete Mediterranean diet. There's a lot of scope, and the key thing is accessing that help.
Yeah, and for example, in our South Asian culture, khichdi, very light dal, very light rice, also mint chutney, to have it incorporated, nice salads with a lot of flavors, whatever the flavors we have. Also, we don't have to have high fat content into them as well. If the summer is we make a scungemi, it's like a lemon drink. That's really, really detoxing with a mint into it. It's really detoxing for the liver, because mint and lemon is so detoxing for the liver. And that's why, when you have hangover from the alcohol, they say have a lemon in the morning, because it really detox your liver. And then you start to, because it controls the bile. And as soon as your bile is controlled, ALT levels goes to normal, your headaches,
So it's true? Because I hear so many people saying a lemon does nothing. And I'll get into this real conflict.
Because it really alter the effect, and that's why it does.
Well, you heard it here, people.
Yes.
You've heard it. Put the lemon in your water. Use a spoon to protect your enamel.
And that's what we're going to be talking in Menopause. Everything is simple, sustainable. Nothing is rocket science. Don't confuse yourself and overwhelm with so much of things. Keep it simple. Suit your lifestyle, your budget, and your daily life. That's what we want. We want everything to be adapted in your daily life with your kids, husband, parents, busy job, whatever you're doing. And all you need to give us is 30 minutes a day. And that's it. And that's in a pocket of time. And we'll make sure you give us those 30 minutes a day.
You heard it here.
Yes.
Oh my God, B, you smashed it. You're so knowledgeable. And the thing is that I talk to you all the time, and I always feel like I'm learning something. I'm always learning new things with you. Thank you. So
wise woman.
It's just, you are a wise woman. I feel privileged to be here, genuinely.
Obviously what I learn in books is separate, but what I learned from my mom and granddad is second. I was very learning from in my family. I'm the one who adapted the most things from my mom and granddad, mom and grandmom. And then obviously what I learned from books, I learn on a practical terms. What is practical to a human? I can't remember things. That's what I am. I like to put things into practical perspective. That's my learning. And that's why my patients always loved. And then I've been community pharmacist since I come in this country. So I learned from my case studies and experiences from different patients and their feedback. And I told them, and they gave me a feedback. And a lot of times they will they will come to me for advice. Then they say, can you phone the doctor for us, please? This is what they should be doing. So this is common. I'm not saying I'm a very clever person. I am not very clever person, but it's just learning from experience and putting myself in person's shoes. I always put myself in the patient or client's shoes and see what is actually possible for them in this moment. And then I make a plan and advise them. I can't tell them, go be a saint, do this, because if it's not practical, it's not going to work for them. And this is what I want to highlight in every human, to take control of health in a simple way.
Yeah, I think one thing that I love is it is through that human interaction and experience of working with that many people that you start to see treating people with dignity, respect, understanding health inequality, and then giving them things that they can sustainably do, but reflection, review. These are not one-stop shops. It's not a wand of magic, and it's really looking at what's inhibiting you, what's stopping you putting some of this in place, what stresses might be getting in the way of you prioritizing your health. And that's why having somebody that sees you as a whole person, it's so important. It's why they put health coaches into GP practices, because we have the time to sit and understand the individual. The GP gets on with clinical, the pharmacist, the physicians, they get on with the clinical. And I think it's so important that you know that you have access to health. Whatever's stopping you from accessing health, try to overcome that with other professionals if you can.
That's very, very important as well. And its control is to take control back in your hands and see where you need the help and who you need the help from.
Yeah, I love this. I love this episode with you.
Yes, thank you so much. And this is just a snippet. We're going to go dig deeper in lot of topics, because how long is our list? People have asked us to cover, but this was the first one, and we can't wait to record so many of them.
Yeah, and do submit the things you still have interest in and want us to cover. Let us know what's important to you. And don't forget, if you are listening after the release of 17th of July to this episode, you've got until the 31st of July 2024. Maybe someone in the future is listening to this, but you've got until the 31st of July to become a founding member of Menopause community for women in their 30s plus. And do keep listening, supporting, sharing, liking, commenting, all the jazz.
Yes, please. I will be very, very grateful. We are here to just help and advise you, but you need to take it.
You can do it. We believe in you. So we'll be back in 7 days with a new episode in Punjabi. Do give us our feedback. And until then, farewell. Stay healthy, stay hydrated. Bye.
Don't forget to share. What did you think of this episode? And click subscribe, like, comment, and share for updates on future new episodes.